the province of Ontario. COVID-19 constitutes a danger of major proportions.
The province takes another drastic step forward, mandating widespread closures in its bid to combat the spread of the coronavirus. The declaration comes as Ontario sees its first COVID-19 related death out of the Royal Victoria Hospital in Barrie. Farah Morelli joins us live now from Queen's Park. And Farah, we know he had COVID-19, but what we don't know yet is if that's what actually killed him.
That's true, Dwight. The exact cause of his death is still under investigation. But what we know so far is that this is a man in his 70s. He's from Barrie. He is believed to have contracted COVID-19 from somebody who had already tested positive. And these two people were inside for several days in close quarters. Health officials say they didn't realize that these two had been in contact with each other until after this man died. And so that is when he was tested. Now, this all comes, as you say, on a big day when the Premier of our province has declared a state of emergency. And part of that announcement was the injection of new money for health care.
It's the news that health officials in Ontario have been bracing for weeks.
It saddens me to report that we've had a COVID-19 associated death in Simcoe, Muskoka. The deceased was in his 70s, had other pre-existing medical conditions that would put him at risk, and so the relationship between his infection and his death is under investigation by the Chief Coroner's Office.
News of that fatality came just hours after Premier Doug Ford declared a state of emergency. Part of that announcement, more money for healthcare workers.
That is why today I'm announcing the first stage of our COVID-19 emergency relief package.
The provincial government is investing $304 million to step up the healthcare response. Here's a snapshot of where that money is going. $100 million will go toward hospital capacity. That's to treat COVID-19 patients. $50 million to bring in more personal protective equipment and supplies for frontline workers, first responders, and patients. Another $25 million will go to set up a fund for respite care, child care services, and other needs specifically for frontline healthcare workers. $50 million will go to making long-term care homes safer, and the remaining funds will go toward things like staffing in residential facilities, protecting seniors in retirement homes, and Indigenous communities.
I applaud the Premier. I think he's done exactly what we were hoping he would do. I can tell you in our hospital, a cheer went up as we heard his announcement.
The head of Toronto's University Health Network said today the money comes as a huge relief.
So I think it means we can just frankly stop worrying about how we're going to fund what we know will be a very expensive and very challenging time in healthcare. I think it also allows many of our staff who are feeling quite vulnerable to feel much less so.
One of the questions health officials face today, why more people are not being tested. The man in Barrie who died was not tested for COVID-19 when he was admitted to hospital.
So far, the issue has been that we have had a shortage of the swabs that are used for testing, but that is being worked on very hard, and they will be up to a good supply very soon.
It's quite clear that there's a much greater desire for testing than is what is actually being able to be achieved.
Now, Dwight, we know that the part of the funding that was announced by the Premier this morning will go toward boosting testing. We know that that includes adding 25 new dedicated COVID-19 assessment centers across the province. But the interesting thing about this case, Dwight, is that this man who died, both this man who died and the person that he was exposed to who tested positive to the virus, neither of them traveled outside the country in the last 14 days, which begs the question of community transmission. This is something that health officials in this province maintain is still very low, but certainly the declaration of the state of emergency is something that is something that was brought in to mitigate that. So we'll have to wait and see what more they have to say as we hear more about this talk of community transmission.
Thank you, Farah. The province's sweeping measures are coming into effect to battle a growing threat, community transmission of the virus. And as Lauren Pelly shows us, public health officials say there are at least 3 suspected cases of community spread in Toronto. Here's what that means and why it matters.
COVID-19 constitutes a danger of major proportions.
Premier Doug Ford warns the
taking this
virus
measure
behind COVID-19
must
continues to
offer a
spread,
full
and Toronto's medical officer of health says it's already transmitting between residents.
We have recently seen a significant increase in cases of COVID-19, some of which are unlinked and thus indicate community transmission.
So what exactly is community transmission? Right now, we know most cases are tied to someone traveling abroad, but this type of transmission is something different. Let's say someone comes to Canada from another country. If they test positive for COVID-19, then pass it on to someone else, there's a clear chain for public health officials to track back to an original source. But now that we're getting more cases in the community, not all of them have clear chains of transmission. This community transmission means the coronavirus could be spreading exponentially, hopping from person to person, making it tougher to track the source.
What we now have clearly is that travel history has ceased to be meaningful. So we have lots of cases in Ontario at this point.
Keeping people apart could keep more people healthy for longer and stop a sudden outbreak overwhelming Canada's healthcare system. That's why experts say social distancing measures are needed now, not later.
That really is just a fancy word to mean that we should be reducing our physical contact with people, which in turn actually reduces the probability of a virus sort of jumping from one person to another.
So for now, until the pandemic passes, this is the new normal. Lauren Pelly, CBC News, Toronto.
So the province has declared a state of emergency, but what does a state of emergency mean exactly? Chris Glover breaks it down for us.
So Ontario has declared a state of emergency, but what exactly does that mean? First, the definition. A state of emergency is a situation or an impending situation that constitutes a danger of major proportions that could result in serious harm. And a disease is specifically mentioned as one of those situations. With a virus outbreak, the big concern is not overwhelming the healthcare system. So trying to stop the spread of the virus through the community is critical. All provinces have the power to declare states of emergency, and while slightly different, they all trace back to World War II. Canada can declare a national emergency, but unlike in the US, that's not required to release federal money. And as a result, Canada has not officially declared a national emergency since the Emergencies Act was passed in 1988. In Ontario, a state of emergency gives the Premier sweeping powers that include limiting personal travel. But so far, we know transit is still running and there are no curfews in place. It also allows the Premier to shut down public, even private buildings. And for now, we know malls and offices can stay open, but most other places, including restaurants and daycares, have been forced to shut down until March 30th. That 2-week period is all that's allowed right off the bat, but it can be extended if officials think the need is still there.
Toronto health officials say the city is dealing with 108 confirmed cases of COVID-19. 4 of those people have recovered.
We've seen an accelerated pace in terms of new case onset in these recent days. And as well, we have seen some early signs of local transmission.
The city is ramping up efforts to reduce community spread by shutting down non-essential services and sending staff home. City Hall, Metro Hall, and City Civic Centers will be closed to the public starting tomorrow until at least April 5th. All staff will continue to be paid, and some may be recalled on an as-needed basis.
We are doing this in the interest of setting an example and following our own advice from our own medical officer of health and other medical officers of health concerning the need for people, wherever possible, to stay home.
Essential services will continue to run, including emergency services, Toronto water, garbage and recycling, hydro, transit, and city shelters. The city says there are currently no confirmed COVID-19 cases among the city's homeless population. But to aid in social distancing, they are opening new shelter spaces. Anyone using them will be screened before being allowed in. The city also has created a program where any homeless persons awaiting test results can stay in isolation. They are also working to find a spot for those who may eventually test positive. It's day one of a new reality for bars and restaurants across the city. The businesses have all been ordered to stop serving customers at their properties. And as Nick Boisvert reports, owners and employees still don't know how they'll get by.
These are all items that seem to be thrown away.
As he looks around his walk-in fridge, Nick Vasilikakos wonders what comes next for his perishable food, and more importantly, his staff.
It's sad because a lot of my employees have been with me for a really long time.
His restaurant, The Blake House on Jarvis Street, is closed today and for the foreseeable future. Longtime server Heather Cameron says that uncertainty is daunting.
We really don't know what to expect, and then that's where rent and mortgages and bills, it will become more and more difficult to take care of those.
Cameron says she'll apply for EI during the closure, but there are concerns many businesses won't survive a long-term disruption. A new report by the Canadian Federation of Independent Business spelled out the dire situation.
As more and more Canadians stay at home, that has meant that tons and tons of businesses in retail and the service sector more broadly, personal services especially, are just not seeing any customers. And in some cases, they're prohibited from opening in the first place.
The survey found that 25% of small businesses couldn't withstand a 50% drop in sales if the situation lasted longer than a month.
I hope, yes, we can get that 25% number if that's a correct number. It's a horrifying number, but not entirely surprising in view of what's going on out there. I hope we can get that number down significantly, really significantly.
Toronto says moves to delay tax collection and establish a contingency fund will help. Premier Doug Ford has also suggested help for businesses is on the way.
Our legislation to provide job security to workers and families and certainty to businesses. As I've said, we will spare no expense to support Ontarians.
Nick Boisvert, CBC News, Toronto.
Closing daycares is part of the state of emergency measures announced by the Premier today. Lorenda Rudakop has a look at what that means for one Toronto family.
Just playing with some Play-Doh. Say hi, Quentin.
Hi. It's a busy household with 3 kids 5 and under. This East York family has already been at home since Friday, social distancing. Mother Alana also worries she could be high risk after multiple bouts of pneumonia. Her 2 boys normally go to an unlicensed home daycare.
Not visiting with friends. We have no play dates.
The following establishments are closed effective immediately until March the 31st.
But the Premier didn't specify all childcare providers in his state of emergency.
All licensed childcare centers.
The Education Ministry says those are the centres under its control. It recommends people using other types of childcare follow the Chief Medical Officer's recommendations to prevent the spread.
I think it's unclear whether unlicensed daycares can operate because there's so many people who need to go to work.
Leg worries about her daycare provider.
We've made a commitment to continue paying for the services that we usually get from her, but we're worried that she may not be able to make ends meet.
It's a switch for 5-year-old Griffin.
Do you miss Paula?
Yeah, I miss going to daycare. One daycare that already decided to close last week sent a letter to parents acknowledging their questions about payments, reminding them that their monthly fee pays salaries and other expenses, saying we are looking at all current options and expect new options to be presented in the coming weeks. A spokesperson from the Ministry of Education says to expect more details in the coming days, as the government is looking at all possibilities, including in terms of assistance. For now, these types of daycares are off limits, and families are adjusting to more time together at home. Lorenda Rudakop, CBC News, Toronto.
The LCBO will remain open during the state of emergency, but its hours will be reduced. Starting Thursday, all LCBO stores will open at 11 a.m. and close at 6 p.m. Delivery is still available, and stores will not accept any returns for the time being. Of course, to keep up on what's open and closed in our city, we've got an up-to-date list right on our website. That's at cbc.ca/Toronto. federal government is expected to announce measures tomorrow to help Canadians financially through these tough times. CBC News has learned the aid package will be worth more than $25 billion. The package will be delivered through existing safety net programs such as employment insurance and the Canada Child Benefit. More details on that tomorrow. Today, the Prime Minister and other authorities were driving home the seriousness of the situation and trying to control the damage with increased efforts to stop the spread of COVID-19. Julie Van Dusen has more.
If you were wondering just how long this COVID-19 virus will last, it's impossible to say.
We don't know exactly how long this is going to take, whether it takes weeks or months, but we know that every step of the way, we will be there to support each other.
What is certain, restrictions on the lives of Canadians will increase. Tomorrow, all federal parks will shutter, adding to the list of places that are out of bounds.
The physical installation of Parks Canada will no longer be open. Parks Canada will no longer admit visitors.
Thankfully, grocery stores are open, and that's one of the reasons the border with the U.S. wasn't closed, says Deputy Prime Minister Chrystia Freeland.
We get our groceries thanks to truckers who drive back and forth across that border.
Doctors, nurses, and medical professionals are on the job. The Prime Minister urged Canadians to stay healthy and not to add to their burden.
Stay home. Don't go out unless you absolutely have to.
It is St. Patrick's Day today, but we have to practice social distancing.
It's unprecedented that on this St. Patrick's Day, celebrations won't be happening as in years past. Canada's health minister broke down as she urged Canadians to be kind in this stressful time.
Check in with vulnerable people by phone. Think of ways you can help to ensure that we get through this together.
Meanwhile, there are up to 3 million Canadians who work or are traveling abroad. Already, thousands have come home. The government is offering loans of up to $5,000 to those who need financial help with travel or living expenses. No matter what, some Canadians will simply be stranded as borders close and flights are cancelled.
There are some of them who will not be coming home in the coming weeks.
The government will announce other measures tomorrow to help people financially. It's also been in very preliminary talks with the provinces about the Emergency Measures Act, which used to be called the War Measures Act and could be used to control the movement of people and goods. Julie Van Dusen, CBC News, Ottawa.
We have a new coronavirus pandemic newsletter. Get the latest news, tips on prevention, and your coronavirus questions answered every evening. You can sign up at cbc.ca/coronavirusbrief.
In the midst of this pandemic and state of emergency, there are many who are trying to help out in any way they can. I'm Kelda Yoon in Mississauga. Coming up, I'll tell you how volunteers across the GTA are coming together to make sure those in need get the help they need, and how one local neighborhood is trying to spread a little bit of joy on this St. Patrick's Day.
A mild day out there, Suzanne, with the sun just trying to peek out, but I'm not sure it was successful.
Well, it finally did come out a little bit, Dwight, but did you see the flurries yesterday evening?
I did, actually.
Weren't they pretty?
No.
Oh, and it continued through the overnight for a little period of time. Hamilton, Kitchener-Waterloo to the west of the city primarily, as we talked about yesterday. 6, 7, 5 degrees. Green for St. Patrick's Day, indeed. 6:15. Glad you could join us. We've got some good weather for you coming up if you like some mild weather. We've got some spring showers, more so than snowfall and spring. Yeah, the spring equinox being marked this week. You can see, by the way, the cloud cover is moving quite briskly out of the west. That mirrors the wind pattern we've had today. Satellite and radar, so that's showing the actual cloud cover moving through and the precipitation superimposed. And yes, some snow significant in parts of northern Ontario, Quebec, and freezing rain even earlier today in Ottawa. Big day in Ottawa, big day for Canada. Be kind to each other. Great message. And the weather's going to be fairly kind to us as we celebrate. We mark the spring equinox. 11:49 p.m. That's on Thursday evening. Now, that doesn't mean that we're done with winter weather. It just means that we've got equal periods of day and night. So the celestial calendar says, yes, that's it. As we jump ahead, and we'll get into your long-range forecast coming up a little later in the program, you'll see that we've got changeable weather for Friday, Dwight. The temperatures will be going up. It'll get quite blustery as well. But we will have some mild temperatures. Some rain to talk about, too, though.
Thank you, Suzanne.
Thanks.
The weather update is brought to you by Train, the most reliable heating and cooling brand. It's hard to stop a train.
Make sure that you're kind to one another. Check in with vulnerable people by phone. Think of ways you can help to ensure that we get through this together. There are scared people. There are lonely people. There are frightened people. And it doesn't take a lot to reach out to them and say that you're there with them, even in spirit.
An emotional plea from Canada's Minister of Health, Patty Hajdu, today, asking Canadians to be kind to one another, and it doesn't take much. Kelly Ewan looks at how people in the GTA are helping out and brightening the days of their neighbors.
Here at the Muslim Welfare Center in Mississauga, Hamara Shami is waiting for bags of groceries to be packed, but they're not for herself.
People are very vulnerable at this point, and I feel like as a Canadian, we must step up and do something.
This afternoon, she's making a delivery to a woman who lives nearby, a refugee from Tanzania who is 6 months pregnant and has no family support.
She reached out to us because now she could not take the public transit, which was not very safe for her to do.
Shami is one of over 800 people across the GTA who have signed up to be a volunteer for the Good Neighbor Project.
So once someone calls, we get all the information, like which area they belong to, which region, the street address, and then we'll go look at our database of all the volunteers who signed up for it.
Volunteers then go out to buy the necessities and drop them off at the person's home. Tariq Syed helped to come up with the idea to help the vulnerable.
It was last week when I was out with my kids doing some grocery shopping, and then we noticed that there were a lot of senior people in the grocery store who were struggling to buy stuff, going through the lines.
This is the real Canadian thing to do, and Canadians are showing their true spirit.
And for those who are able to venture out, Shoppers Drug Mart is dedicating the first opening hour to customers who need assistance, including seniors and people living with disabilities.
I needed bread, I needed some, just some sweets.
Meanwhile, in the Leslieville neighborhood, families have found a way to have a little bit of fun on this St. Patrick's Day.
The idea is people put up a shamrock in their window or on their door, and we walk around the neighborhood and we make it a scavenger hunt.
Are you sure? Yeah, there is. Okay, you counted?
Adele Shaw came up with the idea. Parents were also advised to come out with their kids at different times in order to avoid a large gathering.
I thought it was a great way to keep a sense of community and keep some fun and excitement without being socially isolated.
It's really good, and it gives us time to get fresh air.
We're all doing what we can to stay, I think, a vibrant and happy community.
Kelda Yoon, CBC News, Toronto.
At times, parts of the city look like a ghost town today. I'm Greg Ross. Many Torontonians electing to self-isolate to protect against COVID-19. Coming up, we'll have more on Toronto's unusually empty streets.
It appears most people are starting to heed the warnings and guidance from public health officials, practicing social distancing and self-isolation, but not everyone. So why are some people resisting? Nellie Collada has that story.
What a difference a week can make. A drive through the downtown of Canada's largest city, normally packed with people, today practically empty. Allison Thompson studies ethics and pandemics. If people are complying with health officials' requests, she says it's because the message is getting through.
So we have some pretty good data on this, and we know that people in Canada are really quite willing to comply with these public health measures as long as they understand why they're doing it. So there needs to be transparency about the rationale for these measures. And they also need to know that it's not a disproportionate response to the threat.
This morning, the provincial government issued a state of emergency, shuttering private schools, daycares, and restaurants. In past years, St. Patrick's Day celebrations rocked Toronto's famed Irish Embassy pub. Today, they're closed, the celebration postponed, a decision they made before the state of emergency was issued.
We kind of felt that it may have, let's say, reflected badly on us in the long term if we did open today.
Social pressure, Thompson says, plays a major part in compliance.
We're picking up on social cues from our neighbors. You know, if no one else is going out, we're going to start to wonder, why am I going out? The more we see people trying to stay home and be a good citizen, a good public health citizen, the more difficult it will be for people to justify those kinds of behaviors that are putting other people at risk.
It's a reciprocity, she says, that will be key to flatten the curve and stop transmission of the virus. Natalie Collada, CBC News, Toronto.
During this partial shutdown of our province, the government is urging people to stay home if possible.
Everyone has a role to play, has a responsibility to protect their own health, but also to protect the health of their fellow Ontarians.
Coming up, my conversation with Ontario's Health Minister, Christine Elliott, and what she says you should do if you have symptoms. But first, we'll have a recap of today's developments in the coronavirus outbreak. Stay with us. We'll be right back. Time for a recap of the very latest in the coronavirus outbreak. Today, Ontario declared a state of emergency.
We're facing an unprecedented time in our history. This is a decision that was not made lightly. COVID-19 constitutes a danger of major proportions. We're taking this measure because we must offer our full support and every power possible to help our healthcare sector fight the spread of COVID-19.
As part of the declaration, the province will mandate the closure of many businesses. The order does not yet apply to public transit, shopping malls, grocery stores, and pharmacies. The state of emergency will be in place until the end of the month. The first COVID-19 related death has been confirmed in Ontario. The victim is a man in his 70s who was at the Royal Victoria Hospital in Barrie. Sources in the Ministry of Health tell us the man contracted COVID-19 during close contact with an infected person, but it's not clear if the disease is what killed him. Ontario now has 180 confirmed cases of COVID-19. Toronto Mayor John Tory said the city is shutting down non-essential services.
Critical and essential services will continue to operate, including emergency services. Police, fire, and EMS will, of course, still be on the job. Toronto Water keeps operating so that people will have clean, safe water. Workers in our shelter system and long-term care homes remain on the job, and your garbage and recycling will still be collected. Road operations will continue, so are Toronto Hydro operations and TTC operations.
Tory made the announcement from his own self-isolation. The move means many city workers will also be sent home, but Tory said no one will be laid off and workers will still be paid. Prime Minister Justin Trudeau said today the federal government is doing everything it can to get Canadians who are abroad back home.
There are 3 million Canadians at any given moment around the world living and working, and I think it is just realistic to know that there are some of them who will not be coming home in the coming weeks. But we will make measures available through Global Affairs Canada, loans and supports. We're working with airlines to try and make sure that as many Canadians as possible, as many Canadians as want to, can come home.
Remember, for the latest news on the coronavirus in Toronto, the GTA, and across Ontario, head to cbc.ca/Toronto. As you heard earlier, the province declared a state of emergency today to help stop the spread of COVID-19, and the Minister of Health says the government is looking at more ways to help people in Ontario. I spoke to Christine Elliott earlier today about the state of emergency, asking her first about what the province is doing to help frontline medical workers.
Well, at first, let me say I think they're doing a fantastic job, that they are stepping up to this huge challenge, but we want them to be protected as well. So some of the money that was announced today, the $304 million that's now flowing, is to make sure that we can have the necessary personal protective equipment for them, in addition to the diagnosing swabs and so on. But we want to make sure our frontline workers are kept safe.
What supports are there for workers who are helping us, get the food that we need and the different things outside of the healthcare system that we still need to keep our society running and functioning?
Well, we need to make sure that that line is still open because people still do need food. We need to make sure that we can get food into our grocery stores. We need to make sure that people can have access to medications. Our pharmacies need to be open. They need to get their supplies. But we want to make sure also that we prevent the spread. So there will be other messages that we will be coming forward with in the next several days with respect to some of those economic issues and business issues, but we felt that it was very important to right away get the health measures in place.
We have a lot of rights and freedoms in this province, but that also comes with a lot of responsibility. What is your message to Ontarians in regards of isolation and following the rules to try to keep us all safe during this difficult time?
Well, it's really important for everyone to follow the rules. We are all in this together, and we will all get through it together. But everyone has a role to play, has a responsibility to protect their own health, but also to protect the health of their fellow Ontarians. So if you need to be in self-isolation, please do so. There are resources there to help you. Your local public health unit can make sure that you have food and can get medicine if you need it, but please do follow the rules. We want to make sure that we can keep the positive COVID-19 numbers as low as possible. We want to make sure that our hospitals and other health facilities are going to be able to deal with it. So it is really important that all of us live up to those responsibilities.
The WHO said yesterday testing everyone is important. Now we are hearing from people in our newsroom who think they may have symptoms, that they're being turned away when they try to get tested because they don't fall into the category of having traveled recently or having contact with somebody who has. Are we trying to test everyone, or do we have enough test kits at this point?
Well, we want to make sure that everyone who appears to have signs of the virus is going to be tested. But if people have questions, we certainly urge them to go to our website, which is ontario.ca/coronavirus. There's a self-assessment tool there that people can follow to see if they have any of the signs or symptoms of COVID-19. If they're still concerned, they can either call their family doctor, because they now can do virtual visits over the phone and of course be compensated for that. Or they can contact telehealth. We have hired a number of additional people to work on telehealth to make sure that there can be a timely response to people. Or people can contact their local public health unit to determine where the assessment centers are.
Thank you for your time.
Thank you.
The World Health Organization says fighting the coronavirus requires a two-pronged approach. The first, of course, is social distancing. The second is testing. The Director General of the WHO is calling on health authorities and governments around the world to step up that effort.
This is the defining global health crisis of our time. The days, weeks, and months ahead will be a test of our resolve, a test of our trust in science, and a test of solidarity. Crises like this tend to bring out the best and worst in humanity. This is everybody's responsibility.
People are scared, and that's normal. What we need to make sure that people have is reliable information about what is this virus, how does it spread, how do we protect ourselves and our loved ones.
although we may have to be physically apart from each other for a while, we can come together in ways we never have before. We're all in this together, and we can only succeed together.
As the COVID-19 virus continues to spread, so too does misinformation. Pictures and facts on numerous sites online may not be quite as truthful as they seem. 2 Canadian universities, including Ryerson, have been given federal grants of almost $500,000 to study the issue. Kayla Hounsell has the details.
A post claiming a cure for coronavirus. Garlic is the cure.
For now, there is no cure for coronavirus. This is just one piece of information the social media lab at Ryerson University is tracking.
The conversation around the virus is global.
The World Health Organization calls it an infodemic.
When, for example, SARS was around, we didn't really experience this infodemic, the avalanche of misinformation at the time. Canadians were not as connected at the time. So as a result, we don't really have a proper idea and strategies. How do we deal with misinformation as a society?
Ryerson and Royal Roads University in Victoria have been awarded a federal grant worth nearly $500,000 to study COVID-19 misinformation. They're trying to develop strategies to fight it. They're also creating a tool using fact-checking databases to link to actual messages of misinformation in real time. It's expected to be available to the public later this week.
We believe that it's quite important to highlight those cases so that people get used to seeing what is fake.
Nova Scotia's health minister says his name was used to spread disinformation. That means it was deliberate.
They photoshopped the headers of a particular news organization and included the text. It would look like a social media post from a news outlet, but photoshopped, and that included text that was attributed to me as the health minister.
The news organization quickly countered, saying the fake story that stated Cape Breton Island is in lockdown as a result of the coronavirus didn't come from that outlet and isn't true.
This looks like they're trying to be serious.
Okay.
Although COVID-19 is evolving rapidly, Gruzd says his research will continue for 2 years, hoping to apply the new knowledge not just to this pandemic, but also to future crises. Kayla Hounsell, CBC News, Halifax.
Suzanne, as we count down to the, quote, official start of spring, we could use some warmer weather as we struggle through this pandemic.
You've got the right idea, the official start of spring. And you're absolutely right. I mean, a constant is weather. Whether it's good weather, whether it's bad weather, and the fact that we can talk about it, the fact that the sun will come up tomorrow. And that can be a comforting thought, just a reassuring thought. I had some snowdrops coming up in my garden this morning. They've been up for a while, but they just looked especially beautiful this morning. So just taking a moment, knowing that that constancy of nature and things like weather can provide some stability. Let's talk about the bands of snow, on this Tuesday evening. Yeah, there's just a little bit left, the residual moisture. There's cold air aloft with this system. The atmosphere is doing some really interesting things. A gathering storm stateside. We'll talk about that in just a moment and how that may affect us here at home. Well, it certainly will be affecting us, and we've got some warmer temperatures too. Double digits, by the way, down in Windsor. It's always good to get some perspective on weather. And what struck me for perspective on this map is the fact that way back in the 50s, we had 16 centimeters of snow on this day. Our average for March at this juncture is close to 5 centimeters. So all of that to say that context is important. We got above 4 degrees. We doubled that today in terms of a high. So a warm up at this time of year as the warm air surges north from the southerly latitudes, that's typical. Another thing that's typical is that the temperatures flip-flop back and forth as the jet stream oscillates across our region. Jet stream, a really strong one setting up so that tomorrow night we'll get a little precipitation and Thursday night even more. Tomorrow to the northwest of the GTA, higher terrain up towards Caledon and Mono and the Hockley Valley. We may even see a touch of snow and freezing rain mixing in. That's tomorrow night's brief rainfall. You see that passing disturbance, but a gathering low, upper level low, upper atmospheric support, and a real plume of moisture coming across the Great Lakes Thursday through Friday. Friday's going to be an interesting day. Thursday, 11:49 p.m. is that spring equinox. So officially our first full day of spring is on Friday. And Friday, the temperature goes up. The sun breaks out, the wind picks up as the day goes on, and then Arctic high pressure, reality check. This is the flip-flop, Dwight, of springtime. We're cool, but we should be dry for the weekend. That's the trend at the moment.
Thank you, Suzanne.
Thanks.
This weather update is brought to you by Fairmont Le Chateau Frontenac, the best location for your next spring break getaway in Quebec City.
Amid all the closures, self-isolation, and social distancing, Toronto's looking a bit empty. Greg Ross ventured out today to see what the city looks like under the new normal.
Some parts of the city look like a ghost town today, even during peak times.
It's like a horror movie. It's freaky deaky. It's unsettling, yeah. Right now, there's nothing, right? Just the pigeons.
Union Station is normally packed with commuters, many coming in and out of downtown for work. But most avoided public transportation today. This man did take the subway.
No, it was easy to keep 3 feet away from people. There's a lot of space on there. Very rare.
Subway cars were not the only places unusually empty today. It's lunchtime, and this food court in downtown Toronto is normally packed with people. But instead, we see that they've closed down the seating area completely. And while most of the shops remain open, other than those who work here, there's not many other people. It was more of the same in some of the city's most popular spaces. Dundas Square, the heart of downtown Toronto, always a very popular tourist destination. And normally on a weekday, we would see this place packed with people. But today, not a lot of pedestrian or vehicle traffic for that matter.
Well, normally there'd be, a couple thousand people around in every direction, right? And there's not.
This man says he was here on vacation from Mexico.
Everything is closed. I don't see any attraction for Toronto.
He did get to go shopping at the Eaton Centre, one of the many malls around Toronto still open today, but not very busy.
All right, just pulling into the Yorkdale Mall here. Normally, it is very difficult to get a parking spot close to the front. Today, we're able to pull up and park just steps from the front entrance.
I've never seen it this dead. Even when it's closed, I've never seen it this dead.
This family ventured to Yorkdale Mall because they say they needed to pick up a few things. They didn't seem too concerned about warnings to stay away from public places.
Well, basically, if you don't get too close to people, you're probably all right. Or you use hand sanitizer. I use the hand sanitizer when I went in, when I go out.
This man also went shopping today, but he says it was only because he needed something to help him pass the time while living in self-isolation.
I just picked up an Xbox. Figured if I'm going to be home and can't go out and watch sports, I'll play them at home.
Greg Ross, CBC News, Toronto.
For those of you who are feeling disappointed about spoiled St. Patrick's Day plans here in Toronto today, Mayor John Tory is giving a pretty good incentive to celebrating at home. In a tweet, the Toronto mayor bargains a trade. He says, if you avoid green beer crowd scenes today, I promise to proclaim a nice spring day after COVID-19 has been vanquished as St. Patrick's Day 2 in Toronto, and we will party. The spread of the virus is causing a lot of worry, especially for those who are younger.
Coronavirus is taking over the world. I'm scared that I might get it and it won't go away.
We'll tell you how to talk to your children about the coronavirus and why it's important to stick to the facts. When we come back, we'll have more. Stay with us. The uncertainty of the coronavirus is causing a lot of worry, from school closures, travel restrictions, and constant news updates. It can all be a bit overwhelming. And for many parents, it means calming the worries of their children. Tashana Reed has more.
Brothers Noah and Levi Rackmel are keeping busy. The next 3 weeks will be a lot like this. How come you guys won't be able to go to school?
Because coronavirus is taking over the world. I'm scared that I might get it and it won't go away.
Like many kids, coronavirus is on their minds. Have mom and dad been helping you when you do feel worried?
Yeah. Yeah, they'll either give me a hug or say don't worry.
It's a scary reality, and not just for them, for mom and dad too.
It's been really unprecedented in our lives, obviously, to deal with something like this. I don't think you can help but be anxious as things are progressing the way that they are.
Parents Michael Rackmel and Laura Chadola pulled the plug on their March break trip to Ottawa. With uncertainty in the air, they've been trying to keep calm and reassure their boys.
We're wanting to let our kids know that it is serious, but maybe not giving them all of the detail.
So, how much should you tell your kids? Child and teen psychiatrist Rachel Mitchell says if your kids are young, just stick to the facts.
Avoid abstract concepts. Keep it short, keep it brief. Ask them what they know already. Answer only what they ask.
If you have a teenager, talk to them like they're an adult. And her advice for parents, be aware of the impact of your own anxiety.
Your anxiety rubs off on your child. If you are calm, they are more likely to be calm.
What are some of the things that... For Noah and Levi, despite some worries, they're happy to share what they've learned.
Wash your hands. Wash your hands a lot and not put their pinkies or any kind of finger in their mouth.
For now, the Rackmels say they're keeping things honest and positive at home and will take things one day at a time. Tashana Reed, CBC News, Toronto.
We are just a few days away from the start of spring. We will check in one last time with Suzanne Leonard. She'll have a look at your forecast. Stay with us. We will be right back. Well, at least someone is enjoying themselves as many of us humans stay home. These penguins are taking a bit of a field trip as Shed Aquarium in Chicago remains closed amid COVID-19 concerns. Here's Edward and Annie, rockhopper penguins who are bonded together for nesting season. They're exploring the aquarium's rotunda and looking for some info at the front desk. Right? They would have liked those flurries you called for and we got last night here. Suzanne, what's on tap for tonight other than some green beer at home?
Yes, exactly. And I love the fact that John Tory is going to call St. Patrick's Day version 2 on a nice spring day coming up. That's the great news. Anything that makes you smile, especially with a day like this, state of emergency for Ontario. Here we go. 2 degrees, -5, clear skies, Dwight. No snow flurries tonight. 3 degrees tomorrow afternoon. Mix of sun and cloud. Spring officially Thursday night. As you know, spring equinox. We'll have more coming up.
Yes, we will. Thank you, Suzanne. That
Thanks,
is
Dwight.
it for us tonight. Thank you for joining us. Chris Glover has you covered late night right after the National.